Hey folks, a lot of people are asking for an update on what's happening in the space of medications for obesity, and there have been a lot of developments in the last month or so, so let's talk about that. The first one was about a month ago from the company that makes the medication called Ozampic or Wegovy, which is the drug called semaglutide or semaglutide if you're American. This is the best established weight loss medication that everyone's talking about. It's a medication that reduces appetite at the level of the brain. It also reduces motility of the gut, so food moves through less quickly and makes you feel full for longer. And that results in a weight loss of 10 to 15% of your body weight compared to placebo, and it's been shown in multiple different trials. Conventionally, that's given as an injection once a week. What the company is telling us is that they have tested the oral version of this medication, which in fact is used in diabetes as well, and at high doses, it seems to result in a comparable amount of weight loss to the injection medication. So if this pans out, once we see the peer-reviewed trial data, and if they apply successfully to get this approved, people out there will hopefully have an option for weight loss that gives comparable results through a pill form and won't have to inject themselves. Then a couple of weeks ago, we learned about this medication called Glipron. This was announced at the American Diabetes Association and published as a phase 2 trial in the New England Journal of Medicine. This is another oral medication that works through a similar mechanism, and at least in this phase 2 trial, results in a similar 10 to 15% body weight loss, which is comparable to semaglutide. And so it looks like, and we're going to need to see the phase 3 trial and approvals, but it looks like we're going to have several oral options for effective weight loss. The last one I want to mention is this really exciting trial of a newer molecule called Retitide. This is called a triple hormone agonist, or triple G, because it acts on 3 different hormones. So your typical Wegovy or Ozempic acts on GLP-1 or glucagon like peptide 1. This one acts on that one, but also on glucagon, and also on another hormone called GIP, or glucose-dependent insulinotropic polypeptide. The bottom line is they all do the same thing. They suppress appetite at the level of the brain, and they slow down movement of food through the gut so you feel full for longer. What's really exciting in this trial, though, is that at the highest dose, this medication resulted in a body weight loss of about 24% of body weight compared to 2% for placebo. So we're getting into larger and larger effect sizes and more impressive weight loss. We are going to have to see this in a phase 3 trial and go through all the safety data, etc. But this is potentially very exciting in terms of where we are going with newer agents. So lots of research, lots of activity, lots of excitement in this area, and it's really good to see new molecules that will hopefully come onto the market soon. That will hopefully also create some competition and drive down prices, because ultimately we want these drugs to be more accessible to people out there who are already trying their best with diet and exercise as an add-on to help them to lose that weight.